Okay guys, Timmy coming at you here. What I'm going to do for you today is I'm going to go over some of the anatomical parts of the heart. Okay, so first let's talk some of the basic structures. Alright, look, you got this narrow part of the heart. The narrow part of the heart is the apex of the heart. The narrowest part of any organ is called the apex. And then up here you have the base of the heart. The base is the widest part of any organ. So the heart kind of sits tilted, so your apex of your heart is basically right underneath your breast, left breast. So let's look now at some of the other anatomical features of the heart. All right, you got this big giant vessel that comes off the left ventricle. This whole thing collectively is called the aorta. The aorta is actually broken up into three smaller parts. All right? So let's talk about the aorta. You have the ascending aorta, then you have the arch of the aorta, and then you have down here the descending aorta. And in the arch of the aorta, there are three big arteries that come off the arch of the aorta, and they feed the upper part of the body. This one right here is called the right brachiocephalic artery. Now, if you look at the name brachiocephalic, the brachiocephalic branches into the brachial artery, and then it branches into the carotid artery, the right common carotid artery. Then you have the middle artery here. That middle artery coming off the arch of the aorta is the left common carotid artery. And then again, those supply oxygenated blood to the brain. So if somebody gets plaque buildup in their carotid arteries, then they can have strokes. So you don't want that. You should write that down. All right. Then you have this little artery right here. And this is called the left subclavian artery. And the left subclavian, as the name implies, goes right underneath the left clavicle, clavian clavicle. And then it branches into the axillary artery and the left brachial artery. All right? So those are the three big arteries that come off the arch of the aorta. Now, with the right ventricle, you have this structure that carries deoxygenated blood to the lungs. So the right ventricle's here, and it's going to pump deoxygenated blood to the lungs. So remember, in the strictest of sense, any artery that, or any vessel that carries blood away from the heart is considered an artery. So in the right side of the heart, the vessels are kind of turned around. So in this case, the pulmonary trunk branches into this vessel right here, which is the left pulmonary artery. And this structure right here is obviously the right pulmonary artery. And they carry deoxygenated blood that's high in carbon dioxide and low in oxygen, because it's coming from the cells back to the right side of the heart to get reoxygenated in the lungs. All right. Now, remember, we talked about this, that the coronary arteries that feed oxygenated blood to the heart muscle come off the base of the aorta. So here's the base of the aorta. And you have your right coronary artery and then your left coronary artery. And the left coronary artery branches into, so this is the left coronary artery. And then this is the right coronary artery. And they supply oxygenated blood to the heart muscle. So if one of those arteries gets blocked with cholesterol buildup and cuts off blood supply to a part of the myocardium, you can get a heart attack and grabber. Don't want that. Want to go to gateway. Now, let's talk about this a little bit. The left coronary artery branches into two portions. This branch right here is called the left anterior, yep, descending artery, or it's abbreviated LAD. The LAD you probably have heard of. If that gets blocked, that affects the electrical conduction system of the heart that we talked about and can throw you into what's called ventricular fibrillation. So if that gets blocked with a blood clot and cholesterol and stuff, it's called the widow maker. Because if that gets blocked, the electrical conduction system don't work so good, and then you end up taking a 6-foot dirt nap. Then you got the left main, left anterior descending. Then you have what's called the left circumflex artery. And that supplies oxygenated blood to the lateral, the outside aspect of the left ventricle. Now, this portion of the heart that separates the right and left ventricle, it's made of muscle. And anything that separates cavities in the body is referred to as a septum. So you have a piece of cartilage that separates your right and left nostril. That's called your nasal septum. So in this case, this big piece of muscle here separates the right ventricle and the left ventricle, and that's called the intraventricular septum. It's muscle, so it contracts. Alrighty. Now, let's look at this. You got these two structures here. This is the right auricle, and within the right auricle is the right atrium. So this is the right auricle. And within that structure, and I'll show you that momentarily, there's a chamber, the right atrium. And the right atrium then sends blood into the right ventricle. Then you have the left auricle. And within that is the chamber called the left atrium. And the left atrium sends blood into the left ventricle. Just a quick note here, you can see there is a little structure here. That's called the ligamentous arteriosum. I'm just going to mention this. In a baby, babies don't breathe. So you don't want to be sending blood to the lungs if it's not going to help the baby get oxygen and remove carbon dioxide. So in a baby, this structure is actually a connection between the pulmonary trunk and the descending aorta. And that allows blood that's being pumped by the little fetus's right ventricle to bypass the lungs and then go into the descending aorta. But when a baby pops out and the doctor slaps him on the butt and the kid takes a big deep breath and goes, what the? Right? Because it's a shame you just got born and then you're getting beat up. So the baby goes, hey, what's going on? Takes a big deep breath, and that over time closes off. And when the baby breathes, that will open up the left and right pulmonary arteries, so blood will no longer go through this thing, and that becomes a ligament to kind of anchor the aorta and the pulmonary trunk together. That closes off in the first couple of days after birth. All right. So that's some of the superficial features of the heart. What I'm going to do for you next is I'm going to explain to you some of the